So my name is Jason Golbin. I am the Chief Medical Officer for Catholic Health on Long Island, and it is my pleasure and honor to be sitting here with you, world-renowned athlete, Olympic champion Katie Ledecky. Katie, thank you so much for joining me today.
Thanks for having me. It's exciting to have this conversation.
I am beyond excited, and I look forward to a great conversation. Can you share what makes this collaboration special for you and what you hope that we can achieve together?
Yeah, I am so excited to be here and talking with you and to be the health and wellness ambassador for Catholic Health. I think it's a great opportunity to promote health and wellness to a large number of people on Long Island, to young kids, and really share my passion for health and exercise and overall living a healthy lifestyle.
It shines through in everything you do. I don't have to tell you that, right, as an Olympic champion. But let's take care of the Olympic conversation, right? So tell me about your journey to become an Olympic athlete. What inspired you to start swimming, and how old were you when you started looking at it competitively?
I started swimming competitively when I was 6 years old, but I was in the water before that. My mom swam in college and just knew the importance of teaching her kids how to swim. So my brother and I were in the water from a young age, and my brother wanted to join a swim team when he was 9 years old and I was 6. So we started out on a summer league team, the Palisades Porpoises, and
Palisades, I love that name.
Yeah, the Palisades Porpoises, and we loved it. We loved that first summer of swimming, and so that fall we started swimming year round for a club team. And I didn't have any Olympic aspirations, really. I thought that was very far-fetched and not something that would ever be a part of my life, but I worked my way up all the different levels in the sport. I played other sports as well, but
What else did you play?
I played basketball and soccer. But in 4th grade in gym class, I broke my arm playing basketball. And so at that point, I would say it was a bit of a turning point for me where I realized I really loved swimming when I put a plastic bag over my arm. And
you went in just like that. That's awesome.
yeah, so it got a little more serious around that 10, 11, 12 age. But yeah, made it to the Olympics when I was 15 years old, to the London Olympics, and then I've been to 4 Olympics. So lots of great experiences traveling the world, representing Team USA on the highest level, and setting a lot of big goals for myself that really pushed me every day.
Agree. Was there that aha moment when you said, wow, I can be an Olympic star? Not only can I compete in the Olympics, but I have a chance to actually win this thing. Was there a specific moment that you felt that?
Probably not until I really got to Olympic trials when I was 15 and felt like I was in contention for that team, to make that team. And once I made that team, I was able to visualize myself winning the gold medal, but really wasn't sure until it happened that
it would actually happen, right? But you could visualize it. Did you share that visualization?
I could visualize it. I tried to visualize the best case scenario, the worst case scenario, but I, for some reason, could only visualize myself winning that gold. And
Love that.
it's kind of crazy.
You're right.
Right. That as a 15-year-old, that's how it was. But I think I just had some belief in myself. My coaches had belief in me that I could do something special at that level. And thankfully, I was able to put together a good race and kind of launch the rest of my career off of that first race.
What was it like emotionally when you won that first gold? So here you are, young, relatively unknown, right? Not unknown, but I remember watching it, right? Yeah. What was it like? What did you feel inside?
It felt incredible. I had my family there. My coach was there. I was part of this great Team USA, and I was just so honored to even have that opportunity, and then to, again, put together that race and get my hand to the wall first. It was a moment I'll never forget. It was very surreal. And I still have kind of pictures in my mind of that day and all the different memories.
I can tell you what I was doing at 15. It wasn't winning Olympic gold. So now you have 14 Olympic medals, 9 gold, the absolute most winning woman in Olympic history. What's the biggest takeaway from achieving something at that level?
I think I've learned a lot of lessons through swimming and through the Olympic experiences. I think it's taken a lot of hard work, of course, just every single day. And in swimming, you can't really take too long of a break. And so just a lot of dedication and hard work, but really not just from myself, from so many people around me. I've had lots of great coaches over the years that have believed in me and pushed me. And I really feel like I've had the right coach at the right time and leading into each of the Olympics. And of course, my family, my friends, my classmates, my teammates, they've all played a part in this journey. So it's definitely a community that I feel like I have within the sport. And that community has really supported me each step of the way. And that's something I know I'll have beyond my swimming days, which is really valuable to me.
So I think the community support you have is just incredible, right? If everybody had that kind of support, not that everybody would be an Olympic athlete, but certainly everybody would be better off. But that does not discount the hard work that I know everybody knows you put in. We were here yesterday just getting set up and looking at the pool, and there you were in one of the lanes over there, and just back and forth. We were here, I don't know, hour and a half, 2 hours, back and forth, little pause here and there for just to poke your head up and see what's going on, and then back again. Tell me what that training looks like.
I train 9 to 10 times a week in the pool for about 2 hours each time with my teammates, with my coaches, my friends. And then I also spend about an hour 15 in the weight room 5 days a week. So it's a lot of work. It's a lot of training. And I really think it's not just the hours that I'm putting in the pool or the gym as well. It's the hours that I'm recovering, resting, eating, doing all those things out of the pool to support my training. I think of that as part of the work as well.
Part of the wellness journey, right?
Yes, of course.
It's amazing. What do you, in the gym, you're lifting heavy, doing a lot of core work?
It's a little bit of everything. In swimming, swimming's not just an upper body sport. It's a whole body sport. So just doing things to strengthen the legs, the arms, the core. We do kind of a weight session Monday, Wednesday, Friday, and then more of a conditioning or core type of thing Tuesday and Thursday. So it varies throughout the year, but I really like that routine and the consistency that we have with our training program.
I love it. Now, you've had incredible Olympic success, but no doubt faced challenges along the way. How do you manage these emotions, right? The up and the down, and what's your approach been to dealing with setbacks over the years?
Yeah, I think everyone sees the great moments and the highlights, and I'm happy with my highlight reel and how my swims look. But really, over the course of a week, there are ups and downs. There are good practices, there are great practices, there are horrible practices, there are average practices. So even just within a course of the week, there can be that many ups and downs. And I think I've really learned how to not get too high or too low. I think it's really important to stay very steady. And I've learned that from some of my teammates. I've learned that from my coaches, their emphasis on that. So that's what I try to do. And that definitely aids my performance and contributes to those highlight reels, just being able to stay steady and stay consistent.
So that consistency where it keeps coming up. Now, we're heading into your 5th Olympics, right? So it's LA 2028. This is the first time with Summer Olympics have been in America since, I believe, 1996.
Yes.
How does that make you feel as both a competitor and as an American? And how are you prepping for LA?
I'm really excited for 2028. Of course, it's 2025 now, so there are a few more years to go until we get to that point, and I still have to qualify at the Olympic trials right before the game.
They should give just an exception. Say, all right, you're not.
It's tough in the U.S. And it's something that I love. I love the competition, and I think it's going to be so cool to have an Olympics on U.S. soil, and just to experience that. I think every athlete that I've known that's had that opportunity to compete in front of their home crowd just raves about that experience, and I can't wait to see what that's like.
neither can we, right? And you just said a new world record. You beat your own world record now, I believe, 8 years after you initially said it. How is that even possible at this point in your trajectory?
It's been a lot of hard work and a lot of consistency and really a lot of belief, that that was still possible. Not just from me, but my coach's belief that was possible, and really just every day trying to get better. We talk a lot about improvement, and you might not see improvement every time on the scoreboard or in the results or in the outcome that you maybe are striving for, but in the training every day, in the process every day, if I can see a little bit of improvement in some area, I know that I'm getting better, and I've just trusted that those improvements over time can have an impact on that scoreboard.
I believe it. I think it's probably the same thing in healthcare. All right. So now we spoke a little. I'd love to know what people do outside of their main passion. So we're here at the pool. That's Katie Ledecky. But what do you do outside of the pool?
Well, I like to do a lot of things that everyone loves to do. I love to read. I love to watch movies. I love to spend time with my family and my friends. I've played the piano for many, many years, so sometimes I like to get on the keyboard and play around a little bit.
A little Bruce Springsteen.
A little Bruce Springsteen, yeah. I love music, love listening to music. And really, I consider myself a lifelong learner. I loved going to school, and I finished up my degree back in 2020, and I've continued to try to learn as much as I can in lots of different areas, and some of those things I can apply to my training and kind of things that support my swimming. But I like to just learn about other people, get to know other people. I think those relationships that you can build with others, it's so great to have those experiences.
I love that term, lifelong learning. In medicine, we very much believe that, right? If you don't read, if you don't keep up,
Right.
You're going to get left behind. So we call it exactly the same thing. And we think it's so critical for success over the long term. So to you.
And there's always something to learn. There's always someone out there that knows something you don't know, and there's always something you can try or try to apply to your life. That I think it's always interesting to try to pick up something new.
Well said. We tend to try to take from other professions, other expertise, and bring them into healthcare. What lessons can we learn and apply them to what we do? So I agree 1,000,000%. All right, so now you have your training and your competition and your travel and your family, your friends. You have to balance all that. How do you do that and yet stay grounded?
Well, I think the people around me help me balance everything, and I stay very busy, and swimming keeps me busy. But I do get some good downtime, and after the big competition each year, which is usually in the summer, I usually take a week or two to reset and visit my family. I have a 99-year-old grandmother that I always like to try to go see. So try to just enjoy those little things and get my mind off of swimming, get my mind off of the training when I can, and continue to pursue those other passions that I have as well.
All right. So now, as the health and wellness ambassador for Catholic Health on Long Island, I know Long Island has some special place in your heart. What memories do you have of Long Island? How does that stand out? And then, how does your partnership as our ambassador for health and wellness, how do you think that positions us collaboratively to advance wellness in the Long Island community?
Yeah, well, I mean, my dad and my uncle grew up in Brooklyn and Queens, and my grandmother lived in New York her whole life. And so I have many great memories of going up to New York when I was little. And then, of course, right now, just with my uncle's ownership stake in the Islanders. I know it's an island. Just the Long Islanders, there's just such a spirit to Long Island. And I love being there. I love spending time with everyone there and just enjoying all the little things. And I am so thrilled to be an ambassador for Catholic Health in the health and wellness space. And I'm really excited for what we can do. I think being able to share my journey and give back in any way that I can to this community means a lot to me.
I love it. It's going to be amazing. What does whole body health mean to you, right? Because you are the epitome of whole body health. What does it mean to you?
I think when I think of full body health, I think of treating your whole body with respect and with the attention that it deserves and needs. You know, making sure that you're eating the right things, staying active, getting any care that you need, getting any professional advice, treating your mind well, having different interests, living a balanced life. I think all those things contribute to whole body health. And stay active, but you've also got to stay rested to be able to carry out the functions that you want to carry out. And those are some of the things that I've applied and learned in my swimming career. And I think those are some of the things that I can share along this journey.
Love it. The sleep sometimes is the hardest part. I'm a sleep doctor in real life, and it's very hard even for myself to get there.
So important.
Oh, it's so important. You know, and people underestimate it. But I agree with you 1,000,000%. The care team that you have surrounding you, are they as focused on wellness as you are?
Yeah. I have a great care team and people that I trust and rely on, and just people that want the best for me. And I think that's what you want and what you need to be able to do all the things that you want to do every day.
I agree. What advice do you have for healthcare providers, for physicians like myself, who take care of young athletes? What special things should they be looking for or thinking about that they may not, right? It's not in our training. Okay, here's how you take care of Olympic athletes. What should they be looking for?
Oh man, I think it's hard for me to give a doctor advice, but I think young athletes, are really excited about their future and about what is coming up down the line. I think some young athletes might want to push really hard from a young age, and I think I feel very lucky looking back that my coaches did a really good job of preventing injuries for me down the stream, right? Yeah. They recognized from a young age that I had to swim with the proper technique, and by introducing some different shoulder exercises, we could keep my shoulders healthy for the long term. Just some of those little things that I'm very grateful my coaches were able to think of, and I think if doctors or coaches or parents can think of them for their young athletes, I think that's really valuable. I think it's exciting and it's fun to have success at a young age, but I think if you do have that passion for a sport, you probably want to be able to do it for a long time.
Right. Look at your longevity. It's incredible.
You probably want to be able to do it, whether it's competitively or just eventually recreationally or for exercise. And so I think it's important to always keep in mind, what are some of the risks, what are some of the injuries or issues that I might face moving forward, and how can I think about them now and address them now as opposed to being reactive and down the road.
I love that. We are working to change healthcare, so it's not reactive.
Right.
It's proactive.
Yeah.
I love it. So now switching perspectives, right? We were talking about how a physician cares for a young athlete. I have a young son. He's 5. His name is Aiden. He's awesome. And in preparation for me coming down to see you, we were reading together. We were reading Katie Ledecky books, and he plays tennis and baseball and soccer, and he swims. We're trying to do a little bit of everything. But he said, "Dad, I want to be an Olympic gold medalist." What advice would you have for young athletes as they're growing up into choosing what sport they're going to play?
I would just tell a young kid to have a lot of fun. I mean, that's what I found in the sport from such a young age, and found in everything that I wanted to do. I chose the activities that I thought were fun. And so I would just say have fun, because that's still what I'm doing. That's still why I'm swimming. I wouldn't be swimming if it wasn't fun.
It shines through. I have to say, it literally shines through.
It's so much fun to me to be with my teammates and laugh and joke. And yes, you saw me working out and barely stopping on the wall, but when we are stopped on the wall, we're always
Exactly. Get loud in between here.
it's a good time in the water. And I think if you find something that you love like that, whether that's a sport, whether that's a subject in school, whether that's another extracurricular activity, try to go all in on it and see how much fun you can have. I think that's so important to be able to find what those things are and try to pursue those to the fullest. Well, Dr. Golbin, now it's my turn to ask you some questions. You're on the hot seat.
I'm ready.
No, but it's so fun to have this conversation, and I'm so thrilled to be partnering with Catholic Health to talk about health and wellness. And I wanted to ask you, what does Catholic Health recommend to people to proactively manage their health?
So the way I look at this is there are 4 core things we need to have. You need to have good nutrition. You need to have regular exercise. You need to get a good sleep every night. And number 4, you have to have a good, clear mental outlook. We want to really reduce the stress in people's lives. And then you need a great primary care doctor. And you also need great and open conversation with those doctors. So let me break that down. So healthy diet first, to me, is the hardest. I love to eat. I love to eat unhealthy things. My wife chases me around. But fruits and vegetables, low sugar, low fats, really, feed your body so it can do what it needs to do. Exercise, well, like we talked about, exercise is so critical. I don't run like Katie Ledecky Olympic style, but I try to get out there and exercise regularly. Third one is sleep. So in real life, I like to say in real life, because I'm an administrator now, I'm a sleep doctor. And so I know all about sleep medicine and how important sleep is. When everybody's sleeping 7 to 9 hours a night, try to go to bed around the same time and wake up around the same. It's really, really hard. I have a young 5-year-old, and that doesn't always happen anymore, but I really try to do that. And then we want people to work to reduce their stress. We want them to have hobbies, things that relax them. We want to meditate, to use relaxation techniques. So once you do all that, right, easier said than done, you need to have a great primary care doctor. So on Catholic Health, we have hundreds of primary care doctors, amazing ones, all over Long Island, really from the tip of Queens out to the Twin Forks. And they will be your quarterback. They will guide you and make sure you're getting all the right screening and treatments if you need them. And then you need to have open and honest collaboration with those doctors. Not just those doctors, anybody on your care team. We actually teach communication to doctors. I'll tell you that in medical school, they teach you how to be a doctor. They don't teach you how to communicate. So we, as a condition of working with Catholic Health, we teach our docs how to communicate. So we really foster that communication. And then put all that stuff together. And then we want to work to screen and what we call bend the disease curve, right? We want to change the focus from advanced disease, try to pull that curve so people aren't getting as sick or even sick at all with good proactive care.
All of those things are so important, and those are some of the things that I think about on a day-to-day basis. And I'm so in awe of the primary care doctors and the ones at Catholic Health do such a great job of caring for their patients and communicating with their patients. And so why is this the right time for Catholic Health to be focused on this preventative and proactive care?
So it's a great question. I believe that healthcare is evolving, right? And we want to be at the forefront of that evolution. I call it, we're in healthcare 3.0, but let me go back. Healthcare 1.0, right, was acute episodic care. Something hurts, go to the hospital, we take care of it. Now at Catholic Health, we do it amazing. We do it, we believe, better than anybody else. But that's 1.0, right? Healthcare 2.0 is sort of what I did for the past 15 or 20 years. That's where there's a collaboration between the patient and the care team, but managing chronic diseases like diabetes, heart failure. Actually, we don't even call it heart failure. We call it heart success. To slow the progress of those diseases. Well, we already have those diseases. Healthcare 3.0 is getting ahead of those diseases. It's evolving and changing. What we want to do is we want to move from acute sick care to whole body well-being care. Really changes the equation on how we do that. By doing that, we then can take it from what I call lifespan extension to health span extension. But yes, we're improving the life, but we want you to be healthy and have a great life during that time.
So let's dive deeper into that. How does having a proactive mindset help someone stay healthy?
So like anything in life, right? Really thinking about how your coaches kept your shoulders intact, right? By doing certain movements. It's the same thing. Anything you do early and appropriately, you can reduce the risk of something worse happening downstream. So I'll give you an example. So let's say you go see a cardiologist at Catholic Health, and they say, okay, let's check your cardiac status. So we're going to do an EKG, an electrocardiogram. We're going to do an echocardiogram, an ultrasound of the heart, and we'll do a blood test and look at your cholesterol levels, right? Your LDL. That's standard, really, healthcare 1.0. That's evolving and changing, and we're leading the forefront. For a few years now, we've done what's called coronary calcium scoring. So now I take this same patient, or have these 3 pieces of information, and I'm going to get another piece. I'm going to put them in a CAT scanner, and I'm going to look how much calcium is actually in their heart. Non-invasive, and gives us another piece of information to help guide our therapy, right? Do we need to be more aggressive? Could we be less aggressive? Well, what's 3.0? 3.0 is now what we call coronary CT angiography. So big term means we put you in the CAT scan, we inject some dye into you, and actually we can see the blood vessels on the heart, can see inside of those blood vessels, look at any plaque that may have developed, and it comes with age, comes with lifestyle. And then not just whether there's plaque there and how much it's obstructing the vessel, but is it hard plaque, which is not so bad, or is it soft plaque? That's the dangerous plaque that can cause a heart attack or a stroke. And then we can treat those patients uber aggressively, super aggressively, so that disease doesn't progress. We slow the stem of the disease. Really, really cutting edge work we're doing there. I'll give you another example that one I think you'll love. So I mentioned to you that I run. I run slow, but it's my wife is a breast cancer survivor. She had breast cancer when she was young, and as part of her journey to wellness, or our journey to wellness after her diagnosis, thank God she's many years healthy now. We picked up running, and we 5K, 10K, ran a marathon together, training for a New York marathon this year. But I've gotten my share of injuries along the line, and Catholic Health Physical Therapy keeps me going. So we have Catholic Health PT all over Long Island, and I went to see them with injuries. But what I've done now, again, thinking about the evolution, is I'm seeing them proactively here, changing the way I move and run and jump and work my core to avoid those injuries in the future. Really, really exciting times.
Yeah, that is exciting. And, you told some stories thinking about patients, but beyond just a single patient, I'm sure this proactive preventative care makes an impact on the broader community. So can you talk a little bit about how that can make an impact on the community?
There is a clear outcome changing by doing this care early and aggressively. I'll give you 2 examples. The first one is I'm a pulmonologist too, so I do lungs and ICU and sleep. And we have to take care of everybody, right? We can't just take care of the healthy Olympic swimmers, even though that would be awesome, but we take care of patients who smoke, right? And smoking is really hard to give up. I never fault anybody, but smoking causes, among other things, lung cancer. And so we can now actively screen patients who smoke to reduce their risk of dying from lung cancer. Actually, by doing this, one simple test once a year, we can reduce the chance that they die from lung cancer by 20%. Because that is humongous to have that kind of impact. We don't just look at our patients, we look at our physicians. So if you don't have healthy physicians, it's very hard to care for patients and keep them healthy.
They're like the role models.
Yeah, absolutely. And they can we worry about burnout. There's huge burnout, especially post-COVID in the healthcare community.
Right.
So we have a very robust program that we call Clinician Well-Being and Resilience. So focused on our doctors to keep them healthy. I'll tell you just 2 amazing things we do. First is we have what we call a virtual pager. You remember doctors that used to carry the pager? I carried it for you. Mm-hmm. No more pager. It's virtual. It brings to your phone. But 24/7, we have volunteers throughout the health system who answer the phone. And if one doc has a bad case, a bad day, a bad diagnosis, it weighs on you.
Right.
And sometimes you don't want to bring it home. You need somebody to talk to. a fellow doctor who really understands. So 24/7, you can call this line. It's confidential, and you just have an ear to bounce things through. It has been a game changer for our doctors. I'll give you one more. We take those same doctors now, and we send them out for dinner. When they're out for dinner, we say you could take 10 of your colleagues, ideally people you don't know. We'll pay for it. We actually have one of our psychiatrists donated some money, and you could talk about anything except medicine. No medicine. I want you talking about your hobbies, your swimming, right? What's passionate to you? What do you get excited about besides medicine? And that has really helped strengthen the physician community within Catholic Health.
So we've talked a little bit about individual patients and what you can do to live a healthier lifestyle. What about the broader community? How does that proactive preventative care make an impact on all of Long Island?
One of the most important things we do is we screen for disease. We want to get, again, upstream of that disease. So we are actively screening for many cancers that if we find them early, can make a huge difference. I'll give you some examples. We screen for breast cancer with mammography. We screen for colon cancer with colonoscopy. We screen for cervical cancer. We screen for prostate cancer. By finding and looking for these diseases early, if we find them that they're there, that they've grown despite our healthy lifestyle, we can aggressively treat them and change the outcome of our patients, really impacting our community at levels never seen before.
You mentioned earlier bending the disease curve. Can you talk a little bit more about what that means?
Sure. So we want to change the trajectory of disease. So I know that if you are due to develop diabetes, I know what that trajectory will look like. I know what your sugar is going to do. I know what your insulin and all the downstream disease that comes from it. If we can get to these patients early, change the way they eat, look at the medicines they're on, increase their exercise, we can slow the progression of the disease, sometimes even stop the disease cold in its tracks and not let that disease even come to be. Keeps our communities healthier, it keeps our patients healthier, and it really makes a huge difference. The way we're doing this is we're moving the care from the hospital setting out to the ambulatory setting. Under the leadership of Dr. Rowe, who you know, Dr. Patrick O'Shaughnessy, we've built ambulatory centers throughout Long Island. And these are not two doctor offices. These are multi-center specialties where you see your primary doctor, you see a specialist, you get your imaging, you do your PT, even pick up your pharmaceutical drugs. This brings the care out to the community before the need for more high-end treatment.
So I got one final question for you, and this is a big question, but I think some people might be wondering, well, how do I start? How do I begin to optimize my healthcare? What would be your suggestion to someone just thinking about where do I start?
So I probably should ask you that question. I mean, that's the Katie Ledecky question. In all seriousness, the way we look at our Catholic Health, we put the patients at the center of everything we do. So we want our patients to come. We'll get them a primary care doctor. And that primary care doctor, again, all throughout Long Island, will help them focus on everything we talked about. Eating healthy, nutrition, exercise, sleep. And we'll have that communication to focus and quarterback their care.
Right.
And change their outlook on healthcare. We could stop the disease in its tracks. It is a really, really exciting time for us. Again, we want to change it from lifespan to health span. I want to keep people as healthy as possible and extend their life through that. Katie, it's been an absolute pleasure having you today. I am super excited. We are super excited and privileged to have you as the Health and Wellness Ambassador for Catholic Health. And all I have to say is, long live Long Island.
Long live Long Island.